Did you know that 10 to 20% of pregnancies end in miscarriage? But most likely that number is higher because miscarriages often happen early in pregnancy, before some women even realize they're pregnant. Experiencing a miscarriage can be incredibly challenging, both emotionally and physically. However, many women and couples do look forward to conceiving again. In this video, I'll reveal 11 tips for women to use when trying to conceive after a miscarriage using holistic health practices. Drop me a line below or DM me for my fertility and ovulation tracking checklist. It's a comprehensive tool that I designed to help my patients to track their fertility signs, identify patterns, and optimize their chances of conceiving. Grab my checklist and use it when you're ready. And if you don't know me, I'm Dr. Gina. I'm a board-certified doctor of acupuncture and Chinese medicine. I'm also certified with the Women's Integrative Medicine Institute by MD Aviva Ram. I integrate 2,000-plus-year-old medical practices with the latest in scientific research and medical protocols, including IVF, FET, and hormone therapy. I've helped over 2,000 women and couples to become pregnant and have healthy babies over the last 23-plus years. All the videos that you see and that I've made have at least one actionable health tip for you to take the same day that you watch. Let's get to those tips to recover from a miscarriage. The first, and I'm going to say, I believe that this is the most important step, allow time for healing. Both partners may need time to grieve and heal emotionally after a miscarriage. And it's important that women don't brush off having a miscarriage because they're feeling pressure because of their age, or maybe family is pressuring them, or because of their own plans to have a family. Aside from allowing time to heal mentally and emotionally, it's also essential to give the body time to recover physically. And I want to stress this. Just because a woman is allowing herself the time to heal does not mean that she's pausing her fertility journey. Many of the self-care steps it takes to recover from after having a miscarriage benefit overall fertility and pregnancy health. This healing time is crucial and builds up a stronger foundation, no matter what the cause of the miscarriage. And some people and some women that I've worked with who've had miscarriages may have rushed into getting pregnant again. And if they didn't address healing from the miscarriage, oftentimes they struggle once they're pregnant again because they may have anxiety or stress and worry that they may miscarry again. Having time to work through these emotions is a really important piece of the entire fertility journey. Tip number 2, women benefit from checking in with a healthcare provider to understand when it's medically safe to try again because recommendations can vary based on each woman's medical history. Before attempting to conceive again, it's wise to have a thorough checkup. This can help identify any underlying health issues that may have contributed to the miscarriage and address them proactively. There's so much that can be done to heal properly from a miscarriage. Tip number 3 is nutritional support. A balanced diet rich in vitamins and minerals is crucial for good reproductive health. And women can take prenatal vitamins and make sure they're getting enough folic acid. And there's other supplements that might be appropriate as well. Again, they're on track for healing and also laying a strong foundation to get pregnant again. Foods that support fertility include leafy greens, high-quality proteins such as wild-caught salmon and organic eggs, and complex carbohydrates. Also, foods rich in antioxidants like berries, like blueberries, strawberries, raspberries. These can also help to improve egg and sperm quality. This is a general guideline and needs to be more personalized for women with PCOS or endometriosis or gut inflammation and digestive issues. So that's important to note. If you fall into any of those categories, women who fall into any of those categories will need specific recommendations. Fourth tip is managing stress. High stress levels can impact fertility health. Women often feel much better physically and emotionally when they engage in stress reduction techniques like yoga, meditation, and light exercise. I emphasize light after a woman's had a miscarriage, light exercise instead of rigorous exercise. Also consider things like acupuncture, herbal medicine, or counseling to help manage stress and recover and support emotional well-being. The fifth tip is moderate exercise. Regular moderate exercise can improve blood circulation and healing and fertility health by maintaining a healthy weight and reducing stress. You'll see all these patterns and all these tips, they overlap. and they all support each other and work together. Avoid overly strenuous exercise as that may negatively impact recovery, especially from a miscarriage. Tip number 6 is tracking ovulation. The menstrual cycle can return as early as 4 to 6 weeks after a miscarriage. Understanding the menstrual cycle and tracking ovulation can increase women's chance of conceiving. Women can use either ovulation predictor kits, monitor basal body temperature, or track cervical mucus changes to identify their most fertile days. There's other symptoms to track as well. And just a reminder, drop me a line below or privately DM me for my fertility and ovulation tracking checklist. It's a comprehensive tool that I designed to help my patients to track their fertility signs, identify patterns, and optimize their chances of conceiving. Grab my checklist and use it when you're ready. Okay, tip number 7, supplement wisely. Certain supplements may improve fertility health, but it's essential to consult with a healthcare provider or practitioner because starting any new supplement regimen like folic acid, CoQ10, omega-3 fatty acids, herbal medicines, there's many things. They're often recommended, but it really depends on each individual's medical history and tolerances. Healing from a miscarriage, it may be helpful to focus on blood tonics to help rebuild the blood and heal the womb, but some women may also need to add in blood invigorating herbs to clear out any blood stasis or blocks in blood circulation. One area of food that's very helpful for blood improvement and recovery is bone broth. Tip number 8 is to limit toxins. Reduce exposure to toxins and environmental pollutants, which can affect fertility health. This includes limiting alcohol and caffeine intake, avoid smoking, and choose organic foods when possible to reduce pesticide exposure, as well as hormone disruptors that are often added to foods. Tip number 9, stay hydrated. Proper hydration is vital for optimal bodily functions, including fertility and recovery from a miscarriage. Aim for at least half the body weight in ounces, meaning if a woman weighs 150 pounds, she can shoot to drink 75 ounces of clean water daily. Tip number 10, seek support. Joining a support group or connecting with others who've gone through similar experiences can provide comfort and encouragement, especially on a fertility journey. Mental health is just as important as physical health when trying to conceive. I lead a private and free fertility community that you are welcome to join. Check the notes for the link to request to join. Tip number 11, consult a fertility specialist. If you've experienced multiple miscarriages or have trouble conceiving after a miscarriage, consider consulting a fertility specialist and getting some labs done. They can offer more personalized guidance and explore treatments that might assist in achieving a healthy pregnancy. I work from an integrative medical approach, helping many women to recover from miscarriages and recommend to have a checkup with an allopathic or a Western doctor. And then we go from there on giving personalized recommendations on what to focus on first as far as self-care and foods and supplements and herbal medicine and all things self-care and lifestyle changes. Remember, every individual's fertility journey to conception is unique, and what works for one woman may not work for another. It's crucial to stay in close communication with your healthcare provider throughout the process to ensure that you're taking the right steps for your specific situation and to join a fertility community for more support and guidance. Check the notes for a link to my free fertility group. It's private, and when you're ready to start tracking your cycle again, don't forget, drop me a line below or DM me for privacy, and I'll send you over my fertility and ovulation tracking checklist. It's a comprehensive tool that I designed to help my patients and clients to track their fertility signs, identify patterns, and optimize their chances of conceiving.